Hello everyone, and welcome to our session on eye floaters. Have you ever noticed those tiny specks, dots, or squiggly lines that seem to drift across your vision, especially when you're looking at a bright sky, a plain wall, or even a computer screen? These are what we call eye floaters. They're a very common visual experience, and for most people, they are completely harmless. Today, we're going to explore what floaters are, why they happen, and most importantly, when you should be concerned and seek medical attention. The key takeaway from this first slide is that while they might seem like something on the surface of your eye, they're actually tiny shadows cast by microscopic bits of debris floating inside your eye. To understand floaters, let's take a quick look inside your eye. Most of your eye is filled with a clear, jelly-like substance called the vitreous humor. You can think of it like a clear window that helps your eye keep its round shape and allows light to pass through to the retina. The retina is the light-sensitive tissue at the very back of your eye that sends visual information to your brain. So, how do floaters appear? They are actually tiny shadows. These shadows are cast by small clumps of cells, protein fibers, or other debris that are floating within that clear vitreous jelly. As these tiny bits drift around in the fluid, their shadows move, creating the illusion that specks are floating in front of your eye. You might notice them darting away when you try to look directly at them. That's a perfectly normal, though sometimes frustrating, characteristic of floaters. For the vast majority of people, floaters are a completely natural and harmless part of the aging process. Think of it like this: as we get older, many parts of our body change, and our eyes are no different. Typically, between the ages of 50 and 70, the vitreous humor, that clear jelly we just talked about, naturally starts to liquefy and shrink. As it does, some of its microscopic protein fibers and cells can clump together. These tiny clumps are the most frequent culprits behind the shadows you see. So, if you're experiencing floaters and are in this age range, it's often just a normal sign of your eyes maturing. While age-related changes are the most common reason for floaters, it is absolutely crucial to understand that floaters can also be caused by other factors, some of which are more serious and require immediate medical attention. These causes go beyond the normal aging process and can sometimes signal an urgent eye condition. We'll briefly touch on these now, and then focus on the red flags later that tell you when to seek urgent care. These other causes include posterior vitreous detachment, PVD. This is very common as we age, where the vitreous gel separates from the back of the retina. It often causes a sudden increase in floaters and sometimes flashes. While usually harmless, an eye exam is essential to ensure no damage occurred to the retina during the separation. Retinal tears or detachment. This is one of the most serious causes. If the shrinking vitreous pulls too hard on the retina, it can cause a tear. Fluid can then leak through, causing the retina to pull away, a medical emergency that requires immediate treatment to prevent permanent vision loss. Bleeding in the eye. Vitreous hemorrhage. Blood cells in the vitreous appear as new floaters. This can happen due to conditions like diabetic retinopathy or high blood pressure, or from an eye injury. Inflammation. Uveitis. Inflammation inside the eye can release cells and debris into the vitreous, causing floaters. Nearsightedness. Myopia. Highly nearsighted people are more prone to floaters, sometimes at an earlier age, due to differences in eye structure. Eye surgery or injury. Floaters can appear after certain eye surgeries, like cataract surgery, or following eye trauma. A common question we hear is, are floaters a sign of glaucoma? It's really important to clarify this. Floaters are generally not a direct or primary symptom of glaucoma. Let's quickly define glaucoma. Glaucoma primarily involves damage to your optic nerve. That's the nerve connecting your eye to your brain, often due to elevated pressure inside your eye. This damage can lead to a gradual loss of your side, or peripheral, vision. While floaters aren't a direct symptom of glaucoma, there can be some indirect connections. For example, Both common age-related floaters and glaucoma become more prevalent as people get older. So, it's entirely possible for someone to experience floaters due to normal aging and also develop glaucoma independently. The presence of one does not automatically mean the presence of the other. In very rare instances, specific and severe types of glaucoma, such as neovascular glaucoma, might involve the growth of fragile new blood vessels that can leak blood into the vitreous, which would then appear as new floaters. But this is exceptionally rare. The most crucial takeaway here is that symptoms like a sudden increase in floaters, new flashes of light, or a shadow in your vision are urgent signs that point to a potential retinal tear or detachment. This requires immediate medical attention, regardless of whether glaucoma is present. This is perhaps the most important slide in our presentation. While many floaters are harmless, it is absolutely crucial to know when they might signal a more serious, vision-threatening problem. You should contact an eye doctor immediately if you experience any of the following red flag symptoms. A sudden onset of new floaters. This means a noticeable increase in the number you see, or what might look like a shower of black dots or cobwebs appearing all at once. New flashes of light in the same eye as the floaters. These flashes often look like lightning streaks or camera flashes, particularly in your side vision. A shadow or curtain appearing in your peripheral, side, vision or blocking part of your central vision. This is a very serious symptom. Any accompanying eye pain, redness, or sudden blurry vision. Why is this urgent? These symptoms could indicate a retinal tear or retinal detachment, which are medical emergencies. Prompt treatment is often necessary to prevent permanent vision loss. Your eye doctor will perform a thorough, dilated eye exam to check your retina right away. The urgency and frequency of eye doctor visits for floaters depend entirely on your specific symptoms and the initial diagnosis. Immediate eye exam, urgent care as we just discussed. If you experience any of those red flag symptoms, sudden new floaters, new flashes, a curtain in your vision, or floaters with pain/redness, contact your eye doctor immediately, or go to an emergency room if your doctor is unavailable. This is for urgent care to check for serious problems like retinal tears or detachments. Timely follow-up after a new, non-urgent onset, within days to a week. Even if new floaters appear without any of the urgent, red flag, symptoms, it's still advisable to see your eye doctor for a comprehensive dilated eye exam within a few days to a week. While many new floaters without flashes are benign, your eye doctor needs to confirm this and rule out any subtle retinal issues that might not immediately present with flashes. A PVD itself can sometimes lead to a retinal tear days or weeks after the initial symptoms. Routine follow-up after initial assessment. If floaters are stable once your eye doctor has examined your eyes and determined that your floaters are harmless, for example, typical age-related floaters or an uncomplicated PVD with no retinal tears, your follow-up schedule changes. If you had a new PVD, your doctor might recommend a follow-up exam within 4 to 6 weeks. For most people with stable, harmless floaters, regular annual comprehensive eye exams are usually sufficient. During these exams, your eye doctor will continue to monitor your floaters and overall eye health. Crucially, even if your floaters have been deemed harmless, any new or sudden changes in your floaters or vision warrant an immediate call to your eye doctor, regardless of your last appointment. In summary, your vision is too precious to take chances. Never ignore new or sudden changes in floaters, especially if accompanied by flashes of light or vision changes. Always consult an eye care professional to get a proper diagnosis and guidance. Now let's talk about what happens after a diagnosis. The most important aspect of managing floaters is accurately diagnosing their underlying cause. While many floaters are harmless and require no direct intervention, serious causes demand specific and often urgent treatment. So, how do treatment approaches differ? For the vast majority of common, harmless floaters, the main treatment is simply observation and adaptation. Your brain often learns to filter them out over time, and the floaters themselves may also settle out of your central vision. However, when floaters are caused by something serious, the treatment is focused on fixing that underlying problem. We'll briefly touch on the main approaches, but remember your doctor will recommend what's best for your specific situation. These can include specialized laser procedures, surgery, or treating the root cause like bleeding or inflammation. Let's delve into the treatment for the most common type of floaters, those caused by normal age-related vitreous changes or an uncomplicated posterior vitreous detachment, meaning there are no associated retinal tears. For these, the primary approach is observation and adaptation. This means your brain often learns to filter them out over time, and you might simply become less aware of them. The floaters themselves may also settle out of your central vision due to gravity. However, if these benign floaters are exceptionally large, dense, and significantly interfere with daily activities like reading, driving, or work, even after a period of adaptation, your eye doctor might discuss specific interventions. These are generally reserved for very severe cases where floaters genuinely impair your quality of life. Laser vitreolysis. This procedure uses a specialized laser to target and break up large, well-defined floaters into smaller, less disruptive pieces, or to vaporize them entirely. It can be effective for specific types of floaters, particularly those that are large and located safely away from the retina and natural lens. While less invasive than surgery, potential risks include a temporary increase in eye pressure and, rarely, damage to the retina or lens if not precisely aimed. Not all floaters are suitable candidates for this treatment. Vitrectomy, surgery. This is a surgical procedure where the vitreous humor, the gel-like substance containing the floaters, is carefully removed from the eye. It's then replaced with a clear saline solution or another fluid. The floaters are effectively removed along with the vitreous. While highly effective at eliminating floaters, it is a more invasive surgery and carries higher risks, including cataract formation, retinal tear or detachment, a serious complication, bleeding, infection, and a small risk of permanent vision loss. Due to these potential risks, vitrectomy is typically reserved for severe cases where floaters seriously interfere with daily activities and less invasive options are not suitable or effective. Now, let's look at how we treat floaters when they are a symptom of a more serious underlying eye problem. In these cases, the primary treatment is not for the floaters themselves, but to fix the root cause. For retinal tears or detachment, this is a medical emergency. The goal is to reattach the retina and preserve your vision. Treatments can include laser photocoagulation, using a laser to weld the retina, cryopexy, freezing, pneumatic retinopexy, a gas bubble injection, scleral buckle surgery, a band around the eye, or vitrectomy. For bleeding in the eye, vitreous hemorrhage. When floaters are due to blood, the focus is on identifying and treating the source of the bleeding. This might involve laser treatment for diabetic eye damage, special injections, or a vitrectomy if the bleeding is severe and won't clear on its own. For inflammation, uveitis. Floaters caused by inflammation are treated by reducing the inflammation itself. This typically involves steroid eye drops, oral steroids, or injections. Controlling the inflammation helps clear existing floaters and prevents new ones related to this cause. For floaters after eye surgery or injury, the treatment here depends entirely on what happened. For example, air or gas bubbles injected during certain retinal surgeries will naturally resolve over time. If floaters are due to bleeding or inflammation after surgery, those specific complications would be treated as we just discussed. Many patients ask about medications or supplements for floaters. For the most common, age-related eye floaters, medication is generally not a primary or highly effective treatment option to directly dissolve them. There is no widely proven medication that can reliably eliminate these physical clumps of debris in the vitreous. Enzymatic vitreolysis. This involves injecting specific enzymes into the vitreous. These are primarily approved for specific conditions where the vitreous is abnormally pulling on the retina, and are not typically used for common floaters. Steroid eye drops. If floaters are caused by inflammation inside the eye, steroid eye drops or other anti-inflammatory medications may be prescribed to treat that underlying inflammation. But they don't dissolve existing, age-related floaters. Atropine eye drops. These drops can slightly dilate your pupil, which for some individuals, might shift the floaters out of your central line of sight, making them less noticeable. This isn't a treatment for the floaters themselves, but a way to manage their visual impact. Now, about supplements. This is an evolving area of research. While there's no universally accepted cure for floaters via supplements, some studies have shown promising results for specific micronutrient blends. These supplements are thought to work by reducing damaging oxidative stress, preventing certain processes that lead to vitreous clumping, and supporting overall vitreous health. Common ingredients include L-lysine, vitamin C, zinc, and others. It's very important to understand that these studies generally report a reduction in symptoms, not complete elimination, and more large-scale research is needed. Most importantly, always consult your eye doctor before taking any supplements, especially for specific conditions like floaters. They can confirm the cause of your floaters, rule out serious issues, and advise if a supplement might be suitable for you. While you can't entirely prevent age-related floaters, adopting a holistic approach to health through lifestyle choices and diet can significantly support overall eye health and potentially mitigate the progression or severity of vitreous changes, or reduce the risk of developing floaters from other causes. When it comes to your diet, emphasize a Mediterranean-style diet, which is rich in fruits, vegetables, whole grains, lean proteins, especially fatty fish high in omega-3s, nuts, seeds, and healthy fats like olive oil. This type of diet naturally combats inflammation and oxidative stress, benefiting overall eye health. Prioritize foods rich in specific nutrients known to support eye health, such as vitamin C and E, zinc, omega-3s, and lutein and zeaxanthin. Conversely, try to limit or avoid highly processed foods, sugary drinks, unhealthy fats, and refined carbohydrates. For general lifestyle practices. Stay hydrated. The vitreous is largely water, so drinking plenty of water throughout the day can support its health and clarity. Manage underlying health conditions. Effectively controlling conditions like diabetes, high blood pressure, and high cholesterol is crucial, as they can lead to eye complications that cause floaters. Quit smoking and limit alcohol. Smoking harms blood vessels and contributes to oxidative stress in the eyes. Protect your eyes from UV radiation. Always wear sunglasses that block 99 to 100% of both UVA and UVB rays when outdoors. Reduce eye strain and get adequate rest. Follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds, to give your eyes a break. Also, ensure you get 7 to 9 hours of sleep, as rest is vital for overall bodily function. Manage stress. Chronic stress can lead to inflammation and may increase your perception of floaters. Regular comprehensive eye exams are essential to monitor your eye health and detect any potential issues early. If you ever notice new or unusual floaters, or any changes in your vision, don't hesitate to reach out to your eye care provider. Early evaluation is the best way to protect your vision and ensure peace of mind. To help you better understand some of the terms we've used today, here's a glossary of key eye terms. We'll break this down over a couple of slides so it's easier to digest. First, let's look at these terms. The 20-20-20 rule is a simple guideline. For every 20 minutes you spend looking at a screen, you should look at something 20 feet away for 20 seconds. This helps reduce eye strain. Anti-VEGF injections are medications injected into the eye. They work by blocking a protein that causes abnormal blood vessel growth and leakage, often used in conditions like diabetic retinopathy. Antioxidants are substances that protect your body's cells, including those in your eyes, from damage caused by unstable molecules. A cataract is when the natural lens of your eye becomes cloudy, leading to blurry vision. It's a common condition and can sometimes be a side effect after certain eye surgeries. Cryopexy, or freezing, is a treatment that uses a freezing probe applied to the outside of the eye to create a scar. This scar helps seal the retina to the eye wall, often used to treat retinal tears. Diabetic retinopathy refers to eye damage that can occur in people with diabetes. It's caused by damage to the tiny blood vessels in the retina and can lead to vision loss, and in some cases, bleeding in the eye, which can appear as floaters. Enzymatic vitriolysis, also called pharmacologic vitriolysis, is a medical treatment where specific enzymes are injected directly into the eye to break down certain structures within the vitreous. It's typically used for very specific conditions related to the vitreous, not usually for common, age-related floaters. Continuing our glossary, let's look at the remaining key terms. Glaucoma is a group of eye diseases that damage your optic nerve, the nerve that sends visual information from your eye to your brain. This damage is often due to high pressure inside the eye and can lead to a gradual loss of vision if untreated. Myopia, or nearsightedness, is a common vision condition where objects close up appear clear, but distant objects look blurry. People who are very nearsighted can sometimes be more prone to developing floaters. The optic nerve is the crucial nerve that connects your eye to your brain, carrying all the visual information your eye collects. Posterior vitreous detachment, PVD, is a very common, age-related condition where the vitreous gel naturally separates or pulls away from the back of the retina. This often causes a sudden increase in floaters and sometimes flashes of light. The retina is the light-sensitive layer of tissue located at the very back of your eye. It's like the film in a camera, converting light into electrical signals that are sent to your brain. Retinal detachment is a serious eye condition where the retina pulls away from its normal position at the back of the eye. This is a medical emergency that requires immediate treatment to prevent permanent vision loss. Uveitis refers to inflammation inside the eye, specifically of the middle layer of the eye called the uvea. It can cause floaters because inflammatory cells and debris are released into the vitreous. The vitreous humor is the clear, jelly-like substance that fills the large space between the lens and the retina in your eye. It helps maintain the eye's round shape. Finally, a vitrectomy is a surgical procedure where the vitreous humor is carefully removed from the eye. It's often performed to remove severe floaters or to treat other serious retinal conditions. Let's quickly recap the most important points from today's discussion. Remember, floaters are very common. They are usually harmless shadows caused by normal, age-related changes in the clear jelly inside your eye called the vitreous. However, it's absolutely critical to be aware of the urgent warning signs that could indicate a more serious problem like a retinal tear or detachment. These include a sudden onset of new floaters, new flashes of light, a shadow or curtain in your vision, or any accompanying eye pain, redness, or sudden blurry vision. If you experience any of these red flags, or any new floaters, you must always get them checked by an eye doctor right away. Early diagnosis and treatment are crucial for preserving your vision if a serious condition is present. Finally, while you can't prevent all floaters, you can support your overall eye health through a balanced diet and healthy lifestyle choices. Your vision is precious, and being informed is your best defense. Don't hesitate to reach out to your eye care professional with any concerns.